know what this is.
You are all set, Mary.
Okay, so Sheila and Tom are joining us here. Great. Okay, well, we can get started. Welcome, everybody. Just to mention
Just a
right away.
quick mic check. Can you guys hear Mary okay?
Yeah.
Yes. Okay, perfect.
Good,
Thank you.
good.
Sorry, go ahead.
Yeah. Amazing. Yeah, so there's goodies over there. I hope everybody has seen, helped yourself. Paula, for her last meeting here, has provided some goodies for traditional goodies where we have had them before and loved them, and I think we actually requested them, so. Well, Larry did. Larry did.
So since we're not there, someone have one for me, okay?
One or two for me too. Yeah.
Okay, we'll do it. So I don't think we have a quorum today.
We do.
We do. Okay,
Oh,
Yeah.
good.
great.
Until 3, 4, 5, 6, 7. Didn't I count 8?
We have 8. 1, 2, 3, 4, 5, 6, 7, 8.
Veronica doesn't count.
She's not, Veronica. She's not.
So we don't have.
Yeah. You count, but
We don't have a.
I understand.
No,
Oh,
let's wait because Dorothy might show up.
okay. Well, we're one short of a quorum. We don't really have anything till the end of the agenda.
Okay, so I'll hold on.
But Travis has to leave at 6:30, just so you know.
Right.
Right, and I have to leave early too, unfortunately. I'm overbooked and I have another commitment, so I'll probably sign off about 6:10, but Mary, I emailed you about that, right?
Yes, right. Thanks, Sheila. Good.
Do we ever do proxy vote? Is that anything?
So they can vote remotely
Oh, that
if we establish a quorum.
That's
We
right.
have to establish a quorum in person. Yeah. Right, Veronica, does that sound familiar? Right?
Yeah, that's what the,
That's how the
Yes.
legislature functions. Yeah. Once you establish the quorum in person, then the folks online can participate voting and all such.
Great. Okay. All right. So we'll wait and see if we can do the minutes later.
I see Tom. I see Tom, I see. And I don't know if you guys can hear me, but I can hear you. Yeah, you can hear me. Can't hear them though.
Yeah, I can't hear either.
There's no
You can
sound.
hear- Can you hear us now?
Yeah,
No, I hear
Okay.
you, Frank.
Camera is off.
Okay. Oh, the camera's off. Hold on.
oops.
What happened to the camera?
Ouch. It's not good.
Jeez, my life. So glad we switched to technology.
Mhm.
It was easier when it was all Zoom.
It was easier when it was all Zoom.
sorry.
Now here.
No, not your fault. You spent all this money on it.
Oh.
The only real option is to shut everything down and restart it, and I don't think it's really worth that for being able to see it as long as they can hear us.
Sure.
I
You all
agree,
agree?
yeah.
Yep.
Okay. All right, so we'll just continue on with audio only. Sorry.
That's fine.
Travis, you were
All right, so as I was saying, I'll talk loud so you can hear me. At Cornell, we've hired a new director of counseling and psychological services. His name is David Reitz. He comes to us from RIT, current director. He'll be starting the 19th of December. That's what I know so far.
Good.
What was the name, Travis?
David Reitz, Reetz.
Okay, so it's you, Travis, that's talking, not Frank.
It is.
Yeah, okay.
That's correct.
Mhm.
Well, that's good news, Travis.
Indeed.
Has the position been open for some time or?
I say 6 months-ish,
I'm telling.
5 months. It was a pretty short search, actually.
Yeah. Who was the
Cornell.
previous person?
Alicia Sunsmo was the previous person.
Oh.
Yeah. This is why I love you.
Any other announcements or information to share? Okay. So we'll get into the agenda. I just wanted to mention and recognize Paula for her years of service on both the board and the mental health subcommittee. And I've asked Jan if she would say a few words about what you've done.
Oh, no.
Paula started with the Community Services Board and the Mental Health Subcommittee a little before me. So we've both been around a long time, you just a little longer. And you've always had a long-term commitment to services here in Tompkins County, particularly mental health. And I think a lot of us remember Compost Mentis and your involvement with that. And I've always appreciated your perspective that you bring to the varied topics. You listen very carefully, giving your full attention, and your questions and comments are always thoughtful and often bring into focus the key points of what we should be thinking of. And I really appreciate that. And I'm sure others do too. And those will be the things I'll remember you for, not just this chocolate covered straw. Although they'll come second. But you have been great. And I know at times you've wondered if you're the best person to be in that position, but I think you've been a great person to have in the position. So
Thank you.
Thank you for your.
I appreciate that. I really appreciate having been able to be on this board and how much you can learn from just people who have such a wealth of knowledge and experience. And I will get involved in something, I don't know what yet, in New York City. Lord knows, they've got plenty of programs to work.
That's right.
But I will miss you all.
Yeah.
Well, we wanted to present you
Oh.
Oh,
a certificate. It's an appreciation of all that you
Thank you so much.
contributed here. And we have a plant. I think you have a pretty good green. thumb.
Oh, that's
so-
beautiful.
So buds.
Yeah, thank you.
Yeah, thanks.
Yes, and you will make a contribution wherever you go. So. Great.
And Harmony's already invited my singing group to come
Oh, really?
to the
wow.
holiday party.
Oh,
So we did that on
nice.
Zoom last.
Yes, yeah.
Oh,
Excellent.
that'll
So-
be fun.
I'll be around for a while.
Oh, good.
Good.
Great. All right, well.
That's the
why don't we go?
Motown?
Why don't,
What's that, Sue?
What was that? Sue?
Is
No,
that the
it's not my
Motown?
Motown group. It's my Threshold Choir. Hospital
Ah.
Threshold.
You're singing
I
all
have
of
many
them.
singing groups.
Yeah, you do.
all right. So let's move on to Frank's report.
Sure. A couple of things to update where we have an all-staff meeting on Thursday where we will be actually launching our new name and logo to the department. I will share it with all of you once it goes through them. We wanted to give them first look at it, so I apologize, but there's been a lot of work and energy that's gone into it. We wanted them to see it first. I think you'll appreciate it. We've gone the route of the name is Tompkins County Whole Health now. We talked about that in the past, but the mark itself, we had a team of folks that worked to kind of give feedback to our consultant on what we might want it to be. And it ultimately ended up being similar in concept to what Cuyahoga Health Systems has done, where there's a mark that can then be used, kind of universally through all of the different functionalities and things that we'll be doing. So we'll be working to kind of introduce that mark. And as we do, sharing all of the different things that the new joint department is involved in. And then ultimately the different programs will be able to take that mark and kind of connect it to the name of the work that they do. So the mental health clinic or environmental health or children with special care needs. So we're excited about it. We'll share it with you late this week or early next week, and the Board of Health as well. So you'll get a chance to see it. We've got a bit of a plan, a communications plan that will be unfolding in the last part of December. It'll be more of a coming soon kind of approach. And then beginning in early January, we're going to start a full, kind of press push. There'll be some radio ads, some bus ads. We'll get hopefully some free media from the local newspapers and such. And we'll really be pushing that in the first few months of 2023. So we're excited about that. I'm excited to finally be kicking it off and really be going full speed ahead, as one single department. So we're looking forward to that. At the all staff meeting, we're going to be spending some time. Everyone's coming here. In the summer, we all went up to the health department and kind of did an outside activity on the lawn up there. And so this time we're bringing everybody down here. So the folks at Brown Road can get introduced to this building and kind of get shown around. We're going to break up into 4 different spaces in the building, and the groups, the cohorts will be rotating through all 4 spaces throughout the day. We've got a session on strategic plan, what we've accomplished so far, what we've got ahead of us. We have one on the marketing and messaging around the new merged department. We have a session on getting to know what we do for our clients and the people we serve, and a session on getting to know each other. So as they go through those 4 different sessions in the building, there'll be facilitators kind of leading that effort. So excited about that as well. It'll be the first time since summer that we've all kind of been back together, and we get to do it in this building, which is exciting as well. So lots going on that front. A lot of energy's gone into getting prepared for that. It is a whole day event, so we will be closed. Both departments will be closed for the day. Alcohol and Drug Council will still be open in this building. So we'll be mindful of their clients as we move around. And then our holiday parties are coming up. So we have one at the Brown Road next Wednesday, a week from this Wednesday, and then on the 21st, we have one here as well. So lots of exciting, fun stuff going on in December, hopefully celebrating the folks here and giving them an opportunity to kind of come together and just, be together. And I think that's really all that I had from an update perspective.
I wondered, hey, is there a different plan for introducing it to clients and potential clients?
Yeah. So we're working on that. We have a team that's putting together the communications plan, and part of that is trying to figure out how do we introduce ourselves to the folks that we serve to. So yeah, they'll definitely be included. We're probably going to use emails and text messaging that takes them to our new website. So that's something I didn't mention. We are close to having a new merged whole health website as well. So that will be ready to go in January. So whenever we're pushing it out to folks, we're going to be pushing them with a link to go to the website, which will bring all of the information together in a place that folks can click around on. Yeah.
Any other questions for Frank about that? Can you speak at all about the tone of things? Are people excited about this? Or
it's a good question. I think generally speaking, folks are intrigued. I would like to say there are still some cautiously optimistic folks. But I think there are some folks we still have to convince too. It's a mixture. I think we'll know more tomorrow or Thursday after the all staff meeting. because we'll certainly get feedback throughout the day about how it's going. I think as we've worked on the strategic plan over the last year or so. We have those folks that are gung ho and completely see the benefit and where we're heading and understand the vision. I think we have folks that are, hey, let's give it a try, whatever, however I can be a part of it, I want to be. And then I think we do have some folks that are like, I don't get it. It just doesn't seem like something we should be doing. So I think we expected that, and knowing that we're planning for it. Right. So we're not, we've already said to folks that it's okay to not understand where you fit in this yet, but you need to let us know so we can, help try to, build that bridge for them. So I think we're in a good place. There's always going to be apprehension with change this large.
Yeah.
And I think even when we announced the new name, there was some apprehension about it too. I think it's for those that weren't involved in the process and didn't, know kind of everything that we went through. It took a little bit of explaining so they could, know that it wasn't just me making it up, in a back room. Although there were moments. So I think it's, we really have to do a good job of communicating, as we go forward with this. The logo is probably going to be another thing. There'll be some folks that like it, and there'll probably be others that you spent money on that, right? But I think that's just the nature of what we're trying to achieve here. I think we've tried to be as inclusive as we could. We opened up opportunities for people all along the way to be a part of, all of those decisions, whether it was the name, the new logo, or, any of the cross-functional teams that have been forming. So I think we've done what we could on that front. But that did remind me of one other thing that I should tell you. We are close to having licensed mental health space at Brown Road. So the old home care space that's currently vacant in the building, there's a couple of offices in there. So initially, we are going to have 2 folks up there every day of the week. It'll be different folks, different days, so we can have intakes, we can have therapy, and perhaps even some tele psychiatry and nurse practitioner time. So the idea is to have the full scope of service up there, but at a obviously a much smaller level than we have here, with a goal in the 2023 budget as a capital project, because the rest of the space is cubicles, which is not useful for therapy, of course. So we did get capital money to make all of that office space. So we're hoping that by the end of 2023, that project will be done, and we will have a kind of a full suite up there that will be fully licensed for mental health service, which will allow us to expand even further what we provide up there. So we get to step into it to see, we're looking at which clinicians and folks want to work up there. And then we're also looking at which clients would be interested and want to be seen up there. So we're a lot of progress being made on that. And Harmony and Jeremy and others have been working very hard to get through the licensing process, which is never a small thing, but we're close. And so we're hopeful early in 2023 we'll be offering mental health services up there.
Oh, great.
Okay. So I'm not sure about this next item, Frank. Do we have a guest coming?
No, it's me.
Okay.
Now I'm wondering if they're going to be able to see. Oh boy.
They should still be able.
They should. What did I do? Where did I put it? Hold on a second. Just bear with me. I had it open a minute ago, but it closed. Oh, there it is.
Try advanced.
Or if you
See
just
what-
do screen, they could see it.
Oh, man.
You know.
Because of the camera issue.
I would just do screen.
Yeah, I guess I can do that. Let's see here.
It was Travis. Maybe it was just the person that was going to present. Yeah.
Are you all online seeing a PowerPoint presentation?
Yes.
Yep.
Okay. Cool.
Opiate substance use and overdose data.
That would be it. Awesome. Hopefully. seems to. Oh, sorry, I'm just not giving it enough time apparently. So while it's. Oh, no.
No, you can restart off.
Right, here's your opportunity.
Can you guys still hear us?
Yes.
How can it stop when you're still there?
Let me just see if that. Okay, so we seem to still be okay there. All right, I'm gonna try screen sharing. The camera's still not working. Screen share. Oh, here we go. Now we can do that. All right, can you all see the PowerPoint again?
Yep.
Yep.
All right, we're gonna give this one more go. Just let me do one check here. Yes, it's still doing, so that should catch up eventually in a little bit. All right, give me one more second. Okay, you can see the slides, right?
Mm-hmm.
Yes.
Yes.
Okay, cool. So what I wanted to do is there's a lot of slides here. There's actually 33 slides. So I'm going to go through them really quick. I wanted to share Zoe Lincoln, who is one of our public health fellows, has been supporting the opioid task force that was formed by the legislature. And at their last meeting, she presented a lot of data to them in preparation for their review and planning around how to spend the opioid settlement funds. And so I thought it'd be a good idea for you guys to see what they're hearing and seeing. So if there's something glaringly missing, or if you just want to be informed, you'll know what they're doing. We will send these slides out to you after the meeting, so you'll have them. And on the slides themselves, there are actually links to the source data as well. So you'll see in the bottom right corner, good God. You'll see in the bottom right corner that there is, there's the word source that you can click on to go to things. So let's move quickly so we beat the thing. So what data versus why data, you'll see some of that throughout. A lot of what we've done, particularly on local data. So there's a lot of question about old. Generally, state data is at least 2 years old because they go through a process of verifying and then de-identifying things, and that takes time. So we have local data that's generally more recent, but we have the same challenge in that we want to share as much as we can and be transparent, but we also don't want to identify anyone unnecessarily. So you'll see throughout that there are some places where there's data, but there's might not be year spans, because then the numbers become large enough that it's not as identifiable. Overdose deaths is one we get asked about a lot. While we're in the 20s, low 20s, the number way higher than we want it to be, it's still not really large enough to be de-identifiable if we were to give demographic information. But when we look at it over 10 years, the number gets large enough and it becomes a place where we can. So just a little bit about the data that's in here. And we mentioned the reporting lag. So there was a lot of question about fentanyl strips. I'm not going to read this, but fentanyl strips are for testing drugs for the presence of fentanyl. It is a harm reduction tool that we really want to get into the hands of street drug users, because almost every street drug has fentanyl in it now, and we want people to know and be aware of that as well. But so just information about what fentanyl strips are and kind of how they work. the pros and cons here, right? The pros is it's, they're relatively inexpensive, work quickly, anyone can use them. The cons, they don't indicate the amount generally. The positive result may not deter a frequent user, and in some instances may encourage use because it folks looking for the next high. And we also know that there's stigma associated with these as well, with many harm reductions. And in some places, no longer in New York, thankfully, but having fentanyl is considered paraphernalia. Fentanyl strips is considered having paraphernalia, right? And can be, treated as a crime. We have fentanyl strips in the community here locally at Reach and STEP. So those are for the more active users that they're interacting with. I think there's an effort and an energy around getting these out to, I don't know what the right term is, recreational users maybe, that might not be aware that there's fentanyl in the drug supply. So there will be some discussion, I think, from the group about how we might be able to do that. We talked a little bit about stigma, and there's some information about that. Narcan, I think everyone's familiar with it. We've done a great job of making that fairly ubiquitous in the community, but there are some things that we haven't done that other places have that I think the committee is going to be looking at as well. All pharmacies can dispense it. There are multiple agencies in the community that are set up to be able to dispense it as well. We do it here in the mental health clinic as well. So anyone that comes through that wants it can have it. So we talked a bit about publicly available data, and this is available on our website. If you're not aware, currently on the health department website, but what will soon be the whole health website, there is an opioid page, which has all of these data points there. So it's a good first place to go take a look. But these are the 911 calls that come out of our 911 center. We've started tracking them and posting them once a month. So as you can see, we've seen some upticks, and we can also see that there are spikes at certain times of the year as well that we're going to want to be looking at from a planning perspective. So there's a lot of state data. So much of what we're going to run through now is state data. There are links to this on our webpage. There's also, and you can also go to the State Department of Health to get the data as well. But you'll see that it compares to rest of state and where we are. In many instances, our numbers are lower than rest of state. But they're still higher than where we want them to be. So this is the data really gives us an opportunity to kind of look at where we are and benchmark against that as we try to improve. There's data on emergency department visits and kind of, how those are trending. Drug arrest associated with it. Again, you see the charts end. Can I move this? That's where I can see. The charts end in 2020. Right. And we're about to hit 2023. So there's that lag that we were talking about. It's a little hard in real time to try to address issues with 2-year-old data, but at least it gives us a starting point and a place to look at. So you'll see when you go into the state data, there's a lot of different measures that they compare the different counties against. And so you can see by month and by our numbers against New York State, excluding New York City, right, in the different categories that the state uses. The question came up about heroin overdoses and why that's called out so specifically. We think that's a historical thing because there's been measurement of heroin overdoses for a very long time. And so it's comparing, the state is comparing, historical data and a data point that they've been measuring for a very long time against what they now are measuring as all opioid overdoses. And I will point out in the bottom right-hand corner, that word source, if you click on that, it takes you to the data table when you get the slides. So this is related to admissions to OASIS providers. So we can see information about what's happening in the community related to admissions. There's some, we're going to have to dig into this a bit because low numbers or high numbers could mean different things. It could be good because that means more people are seeking service because it's available, or it could be bad because we have more need. And so therefore there's more people seeking services. So we really have to dig into the data a bit as well. There's some naloxone administration data there as well. And I'm moving through this really, really quick because I just want to kind of give you an introduction to it. And certainly you guys can look at it as you're at your at your leisure. Drug-related deaths, this comes from our medical examiner program. So this is where you can see these numbers are relatively small. So it's challenging for us to give very much more data than the raw number, but we are, Zoe's going back through a 10-year period and trying to pull some demographic data out of that 10-year period, which should hopefully paint a better picture for us, or at least a picture of what's going on related to deaths. And it's also important to point out is deaths at the very end of the line, obviously. Right? We want to get as upstream as we can to try to figure out how do we not have this happen. And you can see there's kind of been a trending 2018 and 19. There was the kind of crackdown on opioids and such and prescribing and really getting Narcan into the community. And I always like to call out Reach Medical in this because that is about where they were kind of really hitting their stride around buprenorphine prescribing in the community. And I'll admit that I was not fully on board with that when they first started, but it is a harm reduction model that is working. And I think it had a positive impact on our community. So here's some more local data on 911, and you can kind of see where we are. Here we are a little bit above the rest of state. Again, does this mean we have more naloxone available? We've more readily adapted it and we're applying it more, or do we have a problem where we have more cases, therefore more naloxone being used? That's the kind of detail that we've got to dig into a little bit as we look at the data. Overdose deaths based off of state data. Emergency department visits. I think that's opioid burden. Yeah. So that's kind of a conglomeration of all the different types of opioid interactions we would have. Again, emissions. Again, does that mean the problem is decreasing? Do we lose availability? You know, we really have to dig in and find out what these things mean to us. First, received an opioid restriction more than 7 days. So again, this was new prescribing. You can see this. There was a big crackdown on prescribing of opioids, particularly pain centers, right? That happened nationwide. That had a pretty significant impact in that time frame. I don't know that we can take credit really for what's happened here so much as there was a shift in how opioids were prescribed across the country. I'm not even sure what all of these are, but we'll move through them. A map, again, talking about geographically kind of how it works and, you know, trying to figure out how the geography of our community is impacted. Looks like we had a lot of naloxone in that dark blue area being provided. Again, does that mean that we had it there and it was being used and more readily adapted in that part of the county? Or do we have more going on that required it? Again, we've got to get into the detail to figure it out. There was a lot of question about harm reduction. So there's a couple of different things in here. Project COPE was something that Zoe had looked up that I believe New York State, the OASIS website is there, that they are pushing as a new harm reduction model. The Datura bags as well. Those are you can put the medication in and it deactivates them. We're actually getting 2,000 of those from the Office for Aging. To be able to get out into the community. So we've asked them for those as well. So some of that is happening already. Zoe talked to our current partners because there was some interest in, what they were doing by the committee members. So there's just a little bit of overview of what they do. Important thing on the Alcohol and Drug Council is the facility up on Trip Hammer, scheduling to open early 2023. So they are close, and we're excited about that because that's really going to help with that initial intake into medical stabilization and detox until we can get folks into the appropriate level of treatment from there. So CARS as well, their services here, the project that they've got going on, the 25-bed female unit. there's been construction delays. And it's unfortunate that we're still waiting. But there's been delays and now costs have risen and now there's not enough money. So a lot of it is about trying to figure out how to get that. The state's still committed to it. CARS is still committed to it. And I think you all are aware that CARS has formally entered into an affiliation with Cuyahoga Health Systems to support them as well. So there's a lot of good things going on with CARS. Their OTP services, so the methadone that they administered, I think they're up to about 150 folks that they're administering to, which is huge because prior to them opening, the closest place was an hour. So that's a big boon for those that need those services. I don't remember what Space Cat was, to be honest with you, but there's a link there. So overdose, suicide, fatality review teams. It was something that was brought up by the committee that that Zoe looked into. There are some communities that's similar to infant and child death review teams. They have opioid review teams. So it was just something, opioid death and suicide review teams. And so it was something that the committee was interested in getting some more information about. So they'll be talking more about that.
Is that, can I just ask a question? Is that, you mean somebody using opioid because they intend to kill themselves? Or are you just saying they're comparing the two?
It's really reviewing those types of deaths to see, it's a kind of a post-mortem to see, is there something that could have been done differently to improve the system so that that didn't happen.
Okay, so they're not really related. It's just something that they keep track of.
Yeah. So the opioid settlement funds, there's some information on the state website about how they can be used. So the committee is going to be reviewing that actually at their meeting tomorrow to talk a bit more about. It's pretty general. There are some monies that have to be spent on opioid related issues. There are other monies that can be spent on anything that the legislature chooses. We've gotten the direction from the legislature that all of the opioid settlement money should be directed towards trying to address the opioid issue. So good news. And that number right now is about $700,000 in one-time funds that we have available. And there's a bunch of different resources here as well for folks to click on. There's a couple of pages to those, and that gets us to the end. And I know I went super quick through that. It really was more of a, wanted you guys to be aware because we have this other group, right? This opioid task force that's reviewing things. Wanted you guys to be up to speed on what they're looking at. Likely their next meeting is tomorrow. We're going to be going over kind of the framework. The state opioid board just put out their recommendations to the state about how the state should spend their share of the funding. And so the good news is it pretty much aligns with what we're already doing or interested in doing in our community. So I don't think there's really anything out of the question there. One of the biggest things that's kind of garnering conversation is harm reduction came out of that. I should give Joe, Dr. Whose reaches Wildman, Justine, thank you. Good God, how did I forget it? She was on that board and played a big role in, I think, carrying the harm reduction message. And so harm reduction is a big part of what was recommended to the state, which is a big step. It's a big step because it's really going to put some pressure on, quite frankly, parts of the state that aren't as receptive to harm reduction as we might be or New York City might be. So it's a good thing. And there's been acknowledgement that there's big problems. These settlement funds aren't going to solve all of those problems. So we need to keep people alive until we do figure out how to solve those problems. So it really is, it was good to see that that was a big part of what was recommended to them. So we'll be talking a bit about that at tomorrow's meeting, just so the task force is, can kind of understand and is aligned on that. And then we're also going to be laying out a framework for taking in proposals, because ultimately that's the main purpose of the task force, at least initially, is to make a recommendation to the legislature on how to spend the funds. So we need a process for that. So we're going to be working on starting up a framework on those for that process. So it's a lot. I went really quick. We will get you the slides so you can look at all the data. There's a lot more data out there than what we showed you. Zoe just kind of picked out the ones she thought were most pertinent. If you don't find the slides, you can always just go straight to our website at the health department, and you can go to the opioid page, and it has links to all of that data as well. And you can click to your heart's content because there is a lot. The state has access to claims data, which is where most of this comes from that we don't have access to, which is another reason why there's always a lag, as well, because it's coming out of Medicaid and other claims data that we don't have access to, which we should have access to, and the insurance companies have access to in real time. So we should too. And that's a battle that's being fought, but it's not been successful so far. But that's a large part of where the data comes from.
I was going to ask, since these are one-time funds, can you still use them in a way that's not one-time, like funding a position over X number of years?
Yeah. I don't think there's a requirement on when they have to be used by, which does allow for some of that. It is one time, so it will eventually run out. But I think there likely will be some interest in doing multi-year funding of projects because one-time funding is difficult to use.
Unless you're
Right.
building like a new facility or something.
Yeah. And so I think much of what people are interested in is programming type stuff. And that takes people, and people is recurring, right? So there'll be some discussion about how they want to administer it.
Do you want me to explain Space Cat?
Yes.
Yeah.
So I blanked out it.
Right, like what is Space Cat? So it stands for the Suicide, Overdose, and Adverse Childhood Experiences Prevention Capacity Assessment Tool. The idea behind Space Cat is it helps you assess in healthcare systems the crossover. Like, not only do we want to look at, okay, how many people have died from an overdose, but we also want to look at what are the social determinants of health, what are the factors underlying people dying of overdose, right? So this is pretty cutting edge assessment because it brings together, you asked the question about suicide, there is a crossover between suicide deaths, overdose deaths, and trauma, right? So you can look at adverse childhood experiences, both from like children, like people who had those experiences in childhood, and then they have a heightened risk of suicide, they have a heightened risk of overdose, they have a heightened risk of combined substance use with suicide potentially, right? Even if they didn't die of an overdose. So it's looking at all those intersections with people and looking at what are some program solutions. So, okay, now that you know this information, how can research also tell you what you can improve in your community to better address it from a systems level? So that's what that tool is looking at. And they're looking at terms like deaths of despair. There are some suicide prevention coalitions and opioid task force that are now combining their efforts because there is such a crossover between those two populations.
Thank you.
I could never remember that name.
Yeah, I even try to come up with it in a moment. So
Any other questions for Frank?
Just curious if we know in general, did it go up during COVID? I mean, did the pressures create more overdoses during COVID? It looked like they steadily increased, but I couldn't tell if it was.
yeah, I think
How to part out the pandemic from.
certainly if you're looking by 911 calls, we've definitely seen it trending up during COVID. The first year it kind of slowed down in 2020 because everyone was kind of locked up at home, but it gradually, as things loosened up, we started to see the numbers go up again as well. I don't know what our overdose numbers are going to look like as far as deaths at the end of this year. I haven't seen the numbers yet, but since COVID started, that number has tracked back up again, which is unfortunate.
Wasn't that kind of a trend, not just in Tompkins County, but
Yes.
just across? Yeah.
Yeah, absolutely. Yeah, and we haven't thankfully kept up with the trend, right? I mean, we're going up, but we're not going up at the same rate as the statewide average or certainly the national average because the number was astronomical, particularly in the second year of COVID with overdose and overdose deaths across the country. And again, I think in large part because of some of the interventions that are already in place in our community through some of our harm reduction, our OASIS licensed facilities, and really just the approach that our community has taken to, dealing with opioids and other drug use had really made an impact in limiting the damage, right? It definitely increased, but not at the same rate.
Okay, thank you. So we're at the point in the agenda where we're going to talk about the slate for our officers for 2023. And as you may or may not know, what we do in the December meeting is make you all aware of who is up for these positions. We need to give you like a 30-day notice period for that, and then we'll vote on the slate in our January meeting. So
The nominations will still be open in that January meeting, so the bylaws require us to do a notification of the slate. And then when the January meetings come around, the first step will be to open nominations. If anyone else wants to run against the candidates, we'd love to have competition. We've never had it in our history. But if anyone's interested, just want you to know that this isn't closing the door. The opportunity is still there in January.
So Stu, do you want to announce the slate at this point, or do you want me to do it? You're muted.
Muted, Stu, we can't hear you.
Tell him that again.
Can you hear me now?
Yes.
And
So I can't see who is there. It's still dark, but Elise Schweitzer is going to be nominated for the chair, and Jan Lynch is going to be nominated for the vice chair. And as Frank said, anybody else who has any interest in being the chair or the vice chair, something to talk about now or during the next 30 days. Bylaws suggest that or state that we have to present the slate and then vote on it, giving the board 30 days to think about it and see if other people want to be able to take on that responsibility. We have a tradition that the chair stays a chair for 2 years and that the vice chair then takes over as chair down the road. So with that in mind, I think we had Elise part-time chair, so I'm not quite sure if this will be a full term, but we can figure that
Yeah,
out.
I think she couldn't do this year. So
Right.
You did it, right?
yes,
Right. So
Okay.
we're going to start off with a full year with the nomination and approval of the board to have Elise be our chair and Jan being the vice chair. That is the slate.
okay, thank you. Good. And as Frank and Stu said, if anyone else has interest, think about it, and there'll be an opportunity to let us know about it. I'm not sure we can do the executive session without a quorum. Is that?
You would not be able to move the names forward without.
Yeah.
Quorum.
Okay.
Also, can you even move to go into executive session without a quorum?
I don't think so.
Probably not.
Probably not. So that takes care of that.
9 is no.
You just wanted to make sure I had absolutely nothing to do at my last meeting ever.
Oh, that's right, because of that.
The folks online don't count, unfortunately. We're one short. So no, I think we're kind of stuck until next month.
Okay.
And we
All right. Yes, we had some reappointments and interest in one of the subcommittee positions, so we can talk about that in January.
Well, let me suggest something. If you can present the names to the floor and nobody feels the need to go into executive session, we could do a straw poll of everyone present, including those. We could let the legislature know that this many members said yes, but we didn't have a quorum because of the in-person need, and let them decide if that's good enough to move forward. Because I'd hate to have folks not be reappointed and not be, and then miss meetings. So just offering that as a suggestion. If you feel no, we need to wait, we certainly can.
I'm comfortable going ahead with that. Is everyone?
Yeah, I like that idea, Frank. I mean,
Okay.
if we got a consensus, then We have Allison. She wants to reapply for developmental disability. And as far as I know, according to Karen, we haven't heard anything from Stacy, so we have just one reappointment. And then something I think the legislators have already approved, which is Jessica Connor, being a member of the Mental Health Subcommittee. So I'm not quite sure how formal it is for us to suggest that we want her, since
He is right here in the room here.
Sitting right here. No.
My understanding was that I was approved for just the overall board,
Okay.
not the
You
subcommittee.
gotta send your name for mental health subcommittee. Is that the one?
Yeah.
Yes.
right. We do have the application for her to
Okay.
apply for that. So
I sure have not yet been invited to any mental health subcommittee meetings, so I think that I am not a member.
Okay.
Right,
right.
true.
Or if I am, I'm a very passive member.
We traditionally wait
Still
until somebody attends a meeting, either the board or the committee, to as part of the criteria in terms of their being approved for it. But I
Send me
see-
the link and I'll be there.
Okay, well, Karen,
You're on it. Okay.
send her the link, get her to the meeting, but
Already on
I would suggest we go ahead and approve Jessica to be on the mental health subcommittee.
And
So we got
I
one-
think.
We
as a-
got one
as a-
reappointment and then one straight out designation to be on a committee.
Right. And as we know, we need 3 board members to be present on subcommittees. So with your leaving, Paula, I think this could be a nice transition for Jessica there too. So.
Great.
So do we actually vote?
Yeah, I would do kind of a straw poll and just see if folks are willing to put those 2 names forward.
So should we do them separately? Any suggestions about that? Just,
Well, I recommend that we conduct a straw poll to see if board members are in agreement to have Allison reapply for DD and for Jessica Connor to be on the mental health subcommittee. Let's do that. And as Frank says, as a straw
Favor?
vote.
okay. It's unanimous.
Tom, are you good? Okay, so we'll just note that there were 7 members present and 2 online that all supported moving those 2 names forward. You're not have a
We have to
quorum.
vote again in January. I think that shouldn't be a problem.
Yeah, I don't think we do. I mean, the legislature is the ultimate, you're just making a recommendation to
Right.
them. So I think in this new world order, hopefully there'll be some consideration that
Mhm.
didn't quite cross the,
Threshold.
yeah.
Not aware that the legislature has a requirement that the members have to be voted by any board, like every board is different.
Yeah,
If this board has the requirement, that issue, I don't know if it does.
yeah, we generally recommend to the legislature the folks.
Mhm. Okay. All right, so I think we've come to the end of our agenda. Any other topics we should touch on?
Just said this is our last meeting of the year, and we just always like to thank you all for giving your time and energy and efforts to helping support us here. We really do appreciate it. It's always great to have your voices be a part of the things that we're doing, and you definitely provide that for us and for the community. And so we're very thankful for the time that you give. And Paula, wish you the best of luck as you go forward. We're definitely going to miss you. So thank you all and have happy holidays.
You too, Frankie.
You as well. Bye.